What is the primary function of a bubble trap during cardiopulmonary bypass? A. To remove any gas bubbles that might form during the oxygenation process. B. To filter impurities from the blood before it enters the heart. C. To monitor the patient's blood temperature during surgery. D. To maintain continuous blood flow during the bypass procedure. Answer: A. To remove any gas bubbles that might form during the oxygenation process. Explanation: a bubble trap is an essential component of the CPB circuit. It removes any air bubbles from the bloodstream before it is returned to the patient. Air embolism is a serious complication, and the bubble trap ensures that bubbles do not enter the arterial line and reach the patient's brain, heart, or other vital organs. Which of the following is the most common cause of hemodilution during cardiopulmonary bypass? A. Increased fluid administration. B. Use of diuretics. C. Excessive blood loss during surgery. D. Reduced fluid intake prior to surgery. Answer: A. Increased fluid administration. Explanation: hemodilution occurs when intravenous fluids, such as crystalloid or colloid solutions, are infused during CPB to compensate for the loss of blood and to maintain volume in the circuit. This dilutes the blood, lowering the hematocrit and reducing the oxygen carrying capacity, but it helps maintain adequate blood pressure and perfusion during surgery. What is the purpose of using an arterial filter during cardiopulmonary bypass? A. To prevent the return of blood clots to the patient. B. To regulate the temperature of the blood being returned to the body. C. To reduce the level of dissolved oxygen in the blood. D. To monitor the flow of oxygenated blood during surgery. Answer: A. To prevent the return of blood clots to the patient. Explanation: an arterial filter is a safety feature in the CPB circuit designed to capture any blood clots, debris, or air bubbles that might have formed in the circuit, preventing them from being returned to the patient. This reduces the risk of embolism and other complications. Which of the following is the most common cause of acute renal failure during cardiopulmonary bypass? A. Prolonged use of vasopressors. B. Hypoperfusion due to inadequate renal blood flow. C. Overuse of heparin during the procedure. D. Hyperglycemia during surgery. Answer: B. Hypoperfusion due to inadequate renal blood flow. Explanation: acute renal failure during CPB is most often caused by hypoperfusion, or insufficient blood flow to the kidneys, leading to ischemic injury. This can be due to a variety of factors, including low perfusion pressure or reduced cardiac output. Other factors such as overuse of heparin or hyperglycemia may contribute to renal complications but are not the most common causes. What is the role of the venous cannula during cardiopulmonary bypass? A. To remove oxygen-depleted blood from the body and return oxygenated blood. B. To provide a site for heparin infusion during surgery. C. To collect blood from the oxygenator and redistribute it to the heart. D. To collect oxygenated blood from the lungs. Answer: A. To remove oxygen-depleted blood from the body and return oxygenated blood. Explanation: the venous cannula is responsible for draining deoxygenated blood from the patient's venous circulation and directing it into the bypass circuit. It then returns oxygenated blood to the patient via the arterial cannula. This allows the heart and lungs to be bypassed during surgery, while the CPB machine oxygenates and circulates the blood. During cardiopulmonary bypass, what is the effect of low-flow conditions on the patient? A. Increased risk of hemorrhage. B. Increased oxygen delivery to tissues. C. Decreased perfusion pressure and organ hypoperfusion. D. Decreased risk of air embolism. Answer: C. Decreased perfusion pressure and organ hypoperfusion. Explanation: low-flow conditions during CPB result in decreased perfusion pressure, which can lead to inadequate blood supply to vital organs such as the brain and kidneys. This increases the risk of organ hypoperfusion, which may result in organ damage. It is essential to maintain an optimal flow rate to ensure adequate tissue oxygenation and perfusion during the procedure. Which of the following is the primary reason for using a blood gas analyzer during cardiopulmonary bypass? A. To monitor blood pH, oxygen, and carbon dioxide levels. B. To assess the blood volume within the bypass circuit. C. To measure the hemoglobin concentration in the blood. D. To measure coagulation parameters during the procedure. Answer: A. To monitor blood pH, oxygen, and carbon dioxide levels. Explanation: blood gas analyzers are used during CPB to monitor key parameters such as pH, oxygen levels, and carbon dioxide levels in the blood. These measurements are critical for assessing the adequacy of oxygenation and ventilation during the procedure and for detecting any imbalances that may arise during bypass. Other parameters like hemoglobin concentration or coagulation tests are typically monitored separately. Which of the following is a typical complication associated with the use of cardiopulmonary bypass in pediatric patients? A. Hyperkalemia. B. Hypocalcemia. C. Hypothermia. D. Increased blood viscosity. Answer: B. Hypocalcemia. Explanation: hypocalcemia is a common complication in pediatric patients during CPB. It occurs because the calcium ions that are essential for normal cardiac and muscle function are diluted during hemodilution, and their levels may drop during bypass. This can lead to issues with myocardial function and blood clotting. Monitoring calcium levels and administering calcium supplements may be necessary to prevent complications. Which of the following interventions is typically used to prevent or manage bleeding during cardiopulmonary bypass? A. Administration of clotting factors. B. Use of platelet transfusions to increase platelet count. C. Administration of protamine sulfate. D. Use of antifibrinolytic agents such as tranexamic acid. Answer: D. Use of antifibrinolytic agents such as tranexamic acid. Explanation: during CPB, antifibrinolytic agents like tranexamic acid are commonly used to prevent excessive bleeding by inhibiting the breakdown of fibrin, which is crucial for clot formation. While clotting factors and platelet transfusions are sometimes required, antifibrinolytics are specifically used to reduce bleeding risk during and after surgery. Which of the following is an indicator that the oxygenator is functioning correctly during cardiopulmonary bypass? A. A stable oxygen saturation of 95 to 100% in the patient's arterial blood. B. A decreased amount of carbon dioxide in the oxygenator. C. A low temperature in the arterial blood returning to the patient. D. An increase in pressure within the oxygenator. Answer: A. A stable oxygen saturation of 95 to 100% in the patient's arterial blood. Explanation: the most important indicator that the oxygenator is functioning correctly is maintaining an oxygen saturation of 95 to 100% in the patient's arterial blood. This ensures that the blood is adequately oxygenated before it is returned to the patient. An increase in pressure within the oxygenator or a decrease in carbon dioxide may indicate issues such as blockage or malfunction, while temperature is typically controlled separately to manage organ protection.